Hello everyone. We have a team which is called Team Xestia. My team includes me, myself, Haris Mansoor, Akshay, and Karen. Akshay has an engineering background. Karen has a journalism background, and I myself have a business background. Uh, so the business plan that we have made, I'll explain you the vision and the objective. So the long-term vision is to provide a reliable and an efficient medical service to the areas of Nigerian Africans. The whole business plan is to provide a portable machine which helps to identify the key diseases in a person through different blood tests by identifying symptoms given by the patient, who will then be linked to a doctor through a video conference. There are so many number of diseases that are in Nigeria right now, but the main ones are HIV, Ebola, malaria is one of the main ones, cold and flu, rabies. These are the main problems people are facing in Nigeria. So our vision and objective, how to target these problems, are to provide a proper, significant medication for malaria through our machine. So our machine will provide on-spot medication dispensary to the patient. It's going to be more easy access for the patient because it's more advanced in technology than a normal hospital. Initially, we will install 5 machines in the areas where the people can't travel to the hospital, in the areas where there are more malaria and diarrhea problems.
Every business needs an opportunity, and our opportunity lies on the lands of Africa, because in Africa 90% of global malaria that occurs. 192.6 million malaria cases reported alone in Africa, and out of which many of the cases are actually not reported. 292,000 children die before age of 5 years in Africa. When we talk about Nigeria, malaria is a major public health problem in Nigeria, where it accounts for more than 97% of the Nigerian population. Only 3% of the population live in the malaria-free highlands. There are an estimated 100 million malaria cases with over 300,000 deaths per year in Nigeria alone. Malaria contributes to an estimated 11% of maternal mortality. Now we'll come to total addressable market. 97% of the Nigerian population are at risk. 100 millions are the registered cases alone in Nigeria, so that is our total addressable market. 300,000 deaths occur due to malaria alone in Nigeria. We'll place 5 machines initially in Nigeria in some regions. We think that we can only cover 0.01%. Then it will account for 10,000 cases in Nigeria as per our location and services. We'll further assume that out of 10,000 we can only cover 10%, so it will cut down more to 1,000 who will actually turn up for the medical aid. Our product is a portable machine, a medical machine that has all latest technology inbuilt in it. When the patient enters the machine, it can measure the blood pressure, heart rate, and can test the blood sample. And then accordingly, it will connect it to the doctor, and the doctor can diagnose the disease and tell the medicines, and then that medicines can be dispensed from the machine only. In our product, a patient can opt for a face-to-face meeting with the doctors via teleconferencing. The information is collected by the sensors of the machine, and the information is sent directly to the doctor in the real time, so the doctor can immediately look at the reports and diagnose the diseases. For an easy prescription refill or an easy diagnosed problem by the Indo medicine machine Xestia, the machine can be also used as a pharmacy, and it is capable of dispensing the most popular medication instantly, and it will also tell the patient about how much treatment would cost. Now we can come to how the machine works. There are 4 possibilities in how a machine can work. Possibility number 1. When the customer enters the machine, customer has an option for either go for the consultation or just read standard symptoms and take the medication prescribed by the machine automatically. If the customer take the machine advice, they can then leave the machine instantly. Now the possibility 2. Customer can select for consultation and pay for it. After that, customer will be connected to doctor instantly. After that, 2 things can happen. Either doctor can diagnose the disease instantly, or doctor can ask for more data to diagnose. In that case, if the doctor easily understand the case and then give the medication, then the patient can take that medication and go out from the machine. But if the doctor asks for more data, like blood test, then customer need to pay for it, and then customer can take the test instantly in the machine, and the report will transmit to doctor instantly via internet. After getting more data, doctor can diagnose it properly and can give proper medication. Now the customer can either leave the machine with prescription, or customer can take medicine from machine itself. So these are the possibilities in which the machine can work. Now we'll talk about customer personas, which is end user profile. We are targeting B2C, that is business to customer. Our customer can be divided into 3 main categories. First, the children who are under 5 years, and then the adults who are in the age group of 18 to 60 years. We have segregated adults, like the adults who are based in urban areas and adults who are based in semi-urban areas. So the children are from the poor families where the decision makers are their parents. The problems they are facing is they have no facilities for healthcare, they have no accessibility, and the needs, they need cheap, dependable and accessible healthcare system. Now we'll talk about adults who live in urban areas. It can be a father, mother, wife. The income group is medium. The decision maker is the adult himself or his family members. The problem is the healthcare over there is very expensive. Yes, it is accessible, but they need more reliable and affordable healthcare. Now we'll talk about the adults who lived in semi-urban areas. The income group is low or poor. The decision maker is adult or his family members. The problem is the healthcare is very expensive and accessibility is very moderate, so they need to travel more and they can spend a lot of money in that. The need is to provide a reliable, affordable and accessible health care. We have calculated the sales projections, the cost. We have taken some assumption in that. Our machine will take around £2,500 to make, which include the cost of software and all sensors available. The assumption 1 is that for projection to be very accurate, we haven't increased the number of machines installed in the span of 5 years. We have assumed that we'll only use 5 machines for 5 years. Assumption 2, we have increased rent, utilities, salaries and sales at the rate of 10% annually for each year until 5 years. Assumption 3 is all the cost is for handling and maintaining 5 machines for 5 years. We have considered the cost for inventory management. As a founder, we will work for free unless business becomes sustainable. All the rates are considered as per average in cities. Rural areas will be more cheaper. Now let's just talk about sales forecast. Our margin percentage will be 50%. We can earn margin on the consultation and medication. Our overheads will look like this. It will include rent, electricity, internet facilities, and inventory manager cost. Our sources and uses of fund will look like this according to each year from year 1 to 5. This is our cash flow forecast. This is our balance sheet forecast. This is our future projections, which will have annual sales, annual net profit, and cumulative monthly net cash. As you can see, it's constantly growing year by year. From the prediction, we can see in the next 5 years will be in profit, and the profit is increasing continuously each year. We have estimated growth rate after 5 years is 30%, and here is the discounted cash flow. We'll now talk about the product and its rating. Xestia is a machine that connects you to the doctor for personal consultation. Its accessibility is very good. Then there is a competition named Kangpi, that's a mobile app that connects you to the doctor. Then comes MobiDoc, that also connects you to doctor for chatting for 24 hours. And then there are regular clinics that operate from 8 a.m. to 6 p.m. Our machine is affordable, it's reliable, and it's accessible. In future, Xestia will diagnose most of the diseases with its state-of-the-art technology. Will make Xestia portable in future so that to cover most of the rural parts of Nigeria. Will then expand to more parts of Africa. We'll try to bring affordable health care at their footsteps.